Karnataka Healthcare Conclave has just been inaugurated, and I'm very happy to be part of this inaugural session. We just heard our Dr. Sharan Patil, who has just given us a very insightful address on the healthcare challenges and issues that are confronting healthcare and the future prospects of healthcare. It was a wonderful speech, Dr. Sharan Patil, and I think it was very illuminating on the subject that we have today. Of course, the convener of the program, Dr. Vijay Bhaskaran Sundaraju, and the chairman of CII Karnataka State Council, Mr. Rabindra Srikantan, and all the other guests and dignitaries who are taking part in this conclave. Healthcare is a very important and a fundamental issue for every society and every government. And it is something that needs to be addressed, and there are always many challenges. I think there are very few countries who have been able to address the problem in its totality and to be able to say that we are providing excellent healthcare in our respective countries or state, because the challenges are numerous. And just like what Dr. Sharan Patil was saying, there are so many various factors which come into play, because the best healthcare tends to become the expensive healthcare. And how do you make that affordable to people? How do you scale it, make it scalable so that the common man, the ordinary person can be able to have that excellent healthcare at a reasonable price. We see in India today that issues concerning health has many a time driven people into poverty. Once something goes wrong in their family, especially the breadwinner, the person who's earning the money, if he falls ill and it is a serious issue, then they beg, borrow, and end up in a severe crisis, both financial, emotional, mental, everything. And they have to, we see the cost of healthcare also skyrocketing. And these are the challenges that we have. How do we bridge the gap? And of course, government is a very big player, but at the same time, government is not able to address every issue that is there in this healthcare segment, because the numbers are very high, and many a treatment is sometimes beyond the capability of the government. It has to be addressed by the private sector, and especially high-end, care. So this is a huge issue, and I'm very happy that CII is doing this conclave. This is the second time they're doing, and it is good that, because people need to come together to discuss, to deliberate, and have an exchange of ideas, so that will lead us to coming out with better solution, or at least make us think that what we can do to address these issues. It is there are so many things that are there in healthcare. It's a huge it's not just one vertical. There are many verticals. There are many issues. There's preventive health, there is curative health, there is wellness, there is so many things, and each specialty has become an institution by itself. Every specialty and super specialty has become a separate vertical by itself. So it is such a vast field that when you start addressing these issues, sometimes we, especially in the government, we tend to get overwhelmed. There is the issue of how do we bring about a good insurance policy? How do we have a policy which works, and which makes it more effective? All these kind of things. So there are many factors, and in our government, we have been trying to address it in the best way that we can. Of course, our Chief Minister has given priority to healthcare, I must say. even in terms of budgeting and the money is required. We have around 4% of Karnataka GDP has been reserved for healthcare, which is, I'll not say is not great, but it is good. Yeah, better than national. Ideally, I think we should be closer to some 5 to 6%, then it makes it even better. So we are investing, and we want to, for us, the priority becomes how we can, improve the basic healthcare and the basic, how do you improve the health of an individual in terms of being able to prevent their health from deteriorating. That is, nutrition becomes part of it. Early diagnosis becomes part of it. And being able to catch them at an early stage. So how do we do that? How do we effectively do that? That is one big challenge, because the earlier we catch them, the lesser the cost for them and for the government to treat them, and the cure is also much more easier to achieve.
If you don't modify your lifestyle and habits, you are going this direction, and that's the power of the data. Only problem is the insurance shouldn't get hold of that data, then you're on dead meat. So we need to understand that based on our genes, diet and disease and environment, we need to make. That means data collection is massively important. I'm very proud to say India is doing a great job. We have started that journey with universal data collection. The way we are able to collect data across and the digital platforms we have. The digital stack of India has done a great job. The amount of transactions we do today is unbelievable. And we are poised to do something fantastic for this large population beyond anybody else in the world. Data sovereignty. I can tell you, every day at SPARSH, they knock the doors to buy our data. We have data from the day one when we started the organization. Everybody wants to buy data because data, nothing is more powerful than data. We need to have data sovereignty. Israel has it doesn't go to the multinationals to keep its data. They keep it themselves. It is so sacrosanct that our data needs to be absolutely protected and needs to be with us. We need this data to be analyzed and customized. We should know which month what happens in which population so that all our resources are appropriately deployed to give the best possible with the resources we have. It needs to be built, train AI on Indian diagnosis. Our problems are different from the West. And when we outsource these things, we are outsourcing the future. Forever will be dictated by the West what we need to do. We need to do it ourselves and customize it for our population. Like I said, Indian genetics, Western pharmacology, Indian diet, Western supplements, Indian hygiene and realities of our social situation, Western protocols. Keep saying, the West says give them almonds and salmon. Is that what we eat? We eat dal chawal. So the diets cannot be imitated from the West. We need to figure out which of our diets has got protein, which of our diets suit us. So everything depends on our ability to analyze our people and customize our medicine. Like I said, the moment you outsource your problem, you outsource your future. Forever, we are going to be depending. We can be a large population consuming a lot. That's not what we want to be. We want to be able to control what we do. We don't want to be slave of somebody else, freebies or pushing their agenda to us. We need to build our own solutions for us. I think Karnataka is very uniquely poised. And I know Shri Dinesh Mundaraju is here, and he's the most young, agile, and a great mind to absorb and execute. So we in Karnataka are highly poised for something spectacular. We could be the model. We could lead the nation. We could light the lamp of healthcare for this nation. Because we produce a humongous lot of doctors, nurses, technicians. Thanks to, I was just looking at your father's initiative of giving many engineering colleges those days. And today, all those engineering colleges, people went on strike. If you give more engineering colleges, first find them jobs. Before that, you cannot give engineering colleges. So look at what we have become as an IT capital of the world because we produce so many wonderful professionals. So a private healthcare or a private medical colleges, engineering colleges, along with the government, when we do it all together, we are the knowledge capital of the world. It's by no default, it is by some phenomenal thinking, phenomenal amount of seeding. When the first ITPL which was done in Whitefield was a seed to something extraordinary which is happening today. And that exact same thing is my imagination for healthcare for the world. When disease becomes when distance becomes not an issue at all because of technology and what we can do, and remote healthcare becomes a possibility, we can rule the world from right here. And we have so many professionals and all of that, but just now we said we're still lacking in the numbers because all jobs are still not taken in the government of Karnataka. So many doctors, nurses jobs are vacant. I don't think it will ever be enough, because we need to change the way we treat. We need to use technology. We need to scale up through technology, not necessarily multiplying people. And there's so many jobs, not necessarily professionally trained people have to do. We have to do job-oriented training at every level. We cannot look, we have to change the direction in which we look and see what else we can do. Like we keep saying, we should do it, we should do it. We, who's we? I think this is what it is. Nobody, no private player, nobody is as powerful as the government. The decisions the government takes can have an enormous impact. Take anything. I keep saying about the example of giving, the air, what's it called? The internet connectivity to the very subsidized cost at which we give different operators of the Airtels and the Spice and all of these people use the airways, which we give it for very less price from the government of India as a policy. Look at what it has done to this country. We are the most internet savvy country in the world. Every person has got access to internet. Nowhere else in the world it's possible. That was one great government decision to subsidize the price of having the airways in this country. And such is a large impact with one great policy, and that's the power. Private players obviously are private players. We don't work without profits. That's a given. If a platform is given, the private players have competition. It's not a monopoly. The pricing takes care of itself, and they will work for profits, but they are the executors. With the platforms, what the government can give, they can execute wonderful things. And this has to be with the buy-in of the citizens, because they are the enablers. If all this chemistry, see, the moment we think private players make money and that's why they should not be encouraged, we do it ourselves, also doesn't work. The government and the private players have to play this together. When we play this together, that's when wonderful things happen, because everybody has got their role. Micromanagement is not the prowess of the government. Macromanagement is the prowess of the government. Micromanagement, competitive world, delivering everything will happen only with... See, these are examples. How was internet born? Internet is nothing but a military part of the US. When they gave it to private players, today everybody is riding on this. It's changed the world completely. GPS was US military power. When they made it accessible to the private people and they put it out there, I can't imagine how people lived without GPS. How did people reach anywhere they wanted to? How did people, Ubers and Zomatos and millions of things are riding on this. Exactly the same what Nandan Nilankini did with us. The Aadhaar cards, the digital pathways, what we have got at this moment are so amazing. So many applications, so many things are happening. This is what I'm saying. Government has to think much bigger than small things, and they need to have brave decisions, brave policies which will change the game. And we have to be partners. Medical tourism. We can be a phenomenal destination for medical tourism if it is a state policy. We earn so much of foreign exchange, and we build hospitals to be of international standard because we have to cater to the people from all over the world. When we do that, same infrastructure is used for our own people, naturally. So our quality goes up, our efficiency goes up, our science keeps improving because we're also earning money in foreign exchange that helps us import fantastic things. That's another matter. If India can do Make in India for India and that kind of a policy, is phenomenal because we start a hospital, we did 3 hospitals in 1 year, 80% of our equipment is imported. I wish we could buy everything Indian. So much of opportunity to do all of this. Lastly, I say these are the 4 Qs. Quality, not just good, but consistent. And this is possible when we do it at scale, digitalize quality, measure it, and deliver it consistently in every part. And it's quantified, it's measured, because data can do that. We can see the outcomes. We can see how we can prevent problems before they happen. And quick access, Google or tech is so universal. You can reach out, and very few areas where we need to pull them out. If I can give the same quality of advice when they walk through my doors, same as what they can sit at home and do it, why should people travel from Jayanagar to Infantry Road? They can do it from home. That's possible. So you unburden the whole thing. And it has to be Indian contextualized. It has to be customized by us. Let Karnataka be the blueprint for India's healthcare transformation. The calling is, the future of healthcare is not imported. It has to be invented. And thank you once again for inviting me. And this is a wonderful forum. I'm sure lovely things will come out of the conversations you're going to have over the period of 2 days. Thank you.